In this presentation, I'll talk about your Medicare choices, and there are quite a few choices to make about your Medicare coverage. But first, let's take a quick overview of Medicare. Part A of Medicare is hospital insurance. It has a deductible. It covers hospitalization and these other services. And there are some other big costs associated with Part A, in particular if a person ends up in the hospital for a long time. Part B is medical insurance. It has a monthly premium, and some people will pay a much higher premium depending on their income. Part B has a small deductible. Part B covers 80% of most of the services that you're going to receive outside of the hospital. You pay 20% of these bills, and there is no cap to your 20%. There's no limit to the total of your bills. One choice you have for your Medicare coverage is just Medicare, but this isn't a very good choice because of that never-ending 20% that I just mentioned. To fill the gaps in Medicare and protect yourself, many people get a Medicare supplement. These are also called Medigap plans because they fill the gaps in Medicare. Medigap plans don't have fancy names, but rather letters. Plans C and G are very popular because they fill most but not all of the gaps. K, L, M, and N will have lower premiums because they don't fill all of the gaps. When I talk to people about Plan F, I say think full coverage, no copays. Now, when a person gets a Medicare supplement, they should get a standalone Part D plan. Part D is voluntary. However, if you don't sign up for it when you are first eligible, you will pay a penalty if you decide to enroll later on. That means a higher premium. So what is the cost of this coverage? Well, there's the Part B premium, and in Arizona, a person turning 65 can get a Plan F full coverage for $136 a month, or right around there. Part D plans range from $15 to $90 per month. $32 is the average cost around the country. Now we've talked about one way to get your Medicare coverage, so let's look at another way, and that is Medicare Advantage. This is another choice that you have. Most Medicare Advantage plans in Arizona are zero premium plans, and most include Part D. Most of these plans include a free gym membership, and some will even throw in a little bit of dental. Medicare Advantage plans are mostly HMOs. This means that you have to stay in the plan's network. PPO plans allow you to go out of network, and there are a few plans in Arizona, but these are going to be more expensive. They will have a premium. Medicare Advantage plans require copays for all services that you receive. If you're considering Medicare Advantage, you need to ask some questions. Are your doctors in that plan's network? Are your prescriptions covered, and at what cost? And what is the MOOP for that plan? MOOP stands for maximum out-of-pocket. This is a limit on your out-of-pocket expenses every year. This protects you from never-ending bills. So why should you work with me? Well, there are so many choices about your Medicare coverage, so many Medicare Advantage plans and Medicare supplement plans and Part D plans, it can be overwhelming. And there are even Medicare Advantage plans for people with chronic illnesses like diabetes. And there are plans for people who are eligible for both Medicare and Medicaid. I help people qualify for extra help. This is getting their Part B premium paid and getting help with their drug costs. So my name is Denise, and I am an independent insurance broker. That means I represent multiple plans, and I don't push one type of coverage, Medicare Advantage, for example, over Medicare supplements, and I don't push one company over another. I help you figure out what the best coverage is for you. You can call me or you can email me, and I am happy to answer questions that you might have even if you're not doing business with me. So I look forward to hearing from you, and thank you very much for listening to this presentation.